Welcome back to Beaufort County News and Views. I'm Catherine Glover, and I'm the director of the Washington Beaufort County Chamber of Commerce. And I'm speaking tonight with Dr. Cheryl Scott, and she's with Dirks Chiropractic. Welcome back.
Thanks.
So we've talked a little bit. We've seen the spine. That's good. I should know that. The spine and everything that you do as chiropractors. And let's talk a little bit. We talked about if you went into the office for the first time, what it would be like. And we mentioned in the last one that if you've had something that's been pain or achy, after about 2 weeks, you would know if it's working or something like that. But how often, if somebody's coming in, say they had like a car accident, but it was 6 months ago, and they didn't kind of jump on it, or kind of come in early, what's kind of the expected time period to help?
Again, we would start, since we're 6 months post car accident, we'd start the same way we did with most patients. Let's try 2 weeks and see how you do.
And see how you do.
And see how you do.
Isn't it important though, right? Like after something happens, you fall, or you know that something that's been traumatic to your body. Isn't it important to kind of go ahead and do it?
It really is. And that's because as soon as your body goes through some sort of trauma, especially when there's ligamentous damage, you start to get fibrous repair, and that's scar tissue. And one of the good things about the chiropractic adjustments is we help align that scar tissue, so there's not as much arthritic degeneration in those joints. Once you get past the 6-week period, it's kind of a magic time frame. The scar tissue is a little more difficult to get aligned, and you may have resulting arthritis later on. So it's imperative to get in.
To go ahead and get in. Why would somebody, so somebody's watching right now and they've got aches, pains, this knee's been hurting them, this back's been hurting them, they were in a car accident. Why would you encourage them to come on in?
So that we can help them live more comfortably. I mean, ultimately, our goal is to make every patient who comes into our office have a more comfortable lifestyle, so they can do the things that they'd like to do. Several patients who come in once a month just so they can do their gardening the way they used to. I have patients who love to mow the grass in the spring to just get their lawns just right. And because of years of construction work or other hard labor, their spines aren't always as healthy as they can be. And so they have a tendency to develop low back pain when they do physical work. And what we do for them, whether it's monthly or every 2 months or every 3 months or just in the spring, whatever works for their bodies, is to help them have the kind of life that they want to have, to help them be as active as they want to be. And we base the frequency of how often they come in really on their lifestyle and what works for their bodies. Everything in our office is pretty individualized. So.
And so I think that's important too, because I think that, you work in connection with primary care doctors or any specialist or anything like that. It's an opportunity to see what you can do to make their life better. So I guess the question too is, why not try it out?
Right. Why not give us a try? What we're doing is non-invasive.
Right.
We're not talking about altering structure. We're not talking about having surgery. We're not even talking about taking any sort of medication. What we do is specifically non-invasive. It's very conservative. I follow all of the particular joint lines and planes. So what I do is mostly beneficial. And if we find that this doesn't work for you, then we almost immediately say, perhaps this is an issue that needs a little bit more investigation, and it needs the kind of interventions that we don't offer. And, and that's okay. You want to know if what's going on in your body, it needs more intensive intervention.
Right. And you, so let's talk a little bit about, your locations and that sort of thing. And, does insurance cover chiropractic care sometimes? It just depends?
It does depend. We accept Medicare, Medicaid, and most other insurances. We try to make things as cost-effective for our patients as we can. And we have a pretty experienced staff. So if you're concerned about what those costs may be, a quick phone call to our office will let you know. We are one of the few offices, I think, that takes even Medicaid. So.
And that's great, because then that, it gives you more opportunity to treat more patients and all that.
To help more people. Mm-hmm. Everybody, regardless of their income, deserves to have a pain-free life, or as close to one as we can help them have.
That's right. So let's talk, you have 3 locations.
We do. We are in Williamston, Washington, and Greenville. I think the last time we talked with you, Dr. Dirks was in Winterville. and Washington. Our Washington location has stayed the same. It's right across the street from the Hampton. Our Greenville, or the Winterville location is now a Greenville location, and it is on Arlington between Evans and Hooker.
Okay.
So right before you get to J.H. Rose.
And
on the right.
Okay, and your new sort of office is Williamston.
Yeah, our new sort of office is Williamston. A mutual colleague of mine, Dr. Dirks, Dr. J. Megason, had a practice in Williamston for 25, 30 years, and he decided to semi-retire to the beach. And he got in contact with Dr. Dirks and I, and we found a way to keep that practice kind of open. So it's been kind of fun to explore that opportunity.
And are you there most of the time?
I am in Williamston on Monday, Tuesday, Wednesday, and Friday. I'm in the Greenville office on Thursdays. Dr. Dirks is in the Greenville office on Monday, Wednesday, and Friday, and in the Washington office on Tuesday and Thursday. So I think the most stabilized has been the Washington office. I think he's been there forever on Tuesdays and Thursdays.
And so where do you sit? Well, actually, let's wrap up real fast because it's time.
Okay.
Give the phone number where they can call. I'm sure if you just call one, you can get all of them.
You can get all of them. Probably the best one to call would be the Greenville 362-0189. That's 252-362-0189. And you can make appointments for any of the offices through that number.
Wonderful. Thank you for being on.
Thank you for having me.
We'll see you next time on Beaufort County News and Views.